We have time for a small number of questions. I see Dr. Jernigan. Uh, it's good that you have a chance to speak up for the first time.
First, looking in here, I can see that there's been a gender convergence in the motor vehicle crash data. And is there an alcohol story underlying that? Are women drinking more these days in the native population? So that's my first question. And my second is both of you mentioned the dry reservation issue, and I know this is, come up over and over again in places like Navajo. And I just wanted to hear you both, I guess, talk about what your take is on that at this point and this issue. And I guess the final thing, just understanding, yes, the relationship between the nations and the U.S. government and the Indian Health Service and BIA and all that, very, very complicated. But is there any way that this committee could recommend something around funding, incentivizing, et cetera, that might make any difference?
Regarding the focus report, that's an area that we're looking into, so I can't really address that right now, but I know there is the female alcohol use is quite high as well with Native Americans, but the men's are still, you know, is higher, but women seem to have a high trend as well, but that's all I can say right now on that.
As far as the dry reservation, we do still have some dry reservations, but we have bootleggers that are still operational. And the U.S. Attorney's Office does prosecute bootleggers yet to date, but it really hasn't, the dry reservation hasn't really had a lot of effect, in my opinion, on our numbers, because it still gets there.
Joanne?
Has there been any kind of a concerted effort to bring law enforcement training programs to the different tribal communities in terms of identifying impaired drivers? By that I mean standardized field sobriety training, the A-RIDE program, the DRE program, to bring that to the awareness level of law enforcement to better understand what they're actually seeing out on the roadways, on the reservations?
Through my grant funding, we provide all of that. We we have, of course, a partnership with NHTSA and with TSI and with the Indian Police Academy. That all of that is offered. A-RIDE is an online training. We've sent some of our officers to the DRE. One tribe this past year, 70% of their DUIs were drug impaired drivers. So we've been also putting out grants for the equipment for drug recognition or indicators of drug use. So we're as progressive as we can be with the tribes, provided they put in their applications and stuff like that. So
I'm sorry, and so the consistency of the training amongst the tribal community, it's the same training. So we're seeing, for as diverse as the tribes can be in terms of their laws and in terms of those kinds of things, that the training that your organization is trying to bring is more of the consistent training, the validated studies, those kinds of things.
the training we offer is consistent with what any law enforcement gets. It has to be. Where the inconsistency lies is the tribes being able to send their people, because a lot of times they don't have the people back home to cover. So we've tried to do regional trainings, but we still have that issue where the tribes just don't have people to send, to the trainings. Yeah, yeah.
Julie?
Just want to thank both of you for being here. I really appreciate that you took the time to do this. And one of the things I wanted to ask about is with this jurisdiction issues, if you could provide some examples. You mentioned that there have been some good success stories too of the states and jurisdictions working together, or the tribal jurisdictions. And how is that? If you could give some examples of what's been effective there, how you've done that.
It's not necessarily what we've done, it's what the tribes have done in working with the states. A lot of our tribes that have good cross commission programs, a lot of those tribes have actually non-members running their police departments just because they don't have enough members that want to get in law enforcement. So they end up having to hire from the outside. So they bring in people from other jurisdictions that, maybe they offer better funding, maybe they offer better fringe benefits. So officers will do exactly what they're doing a lot of times is they're moving from the tribes to the state, but if you have a good program with a lot of funding, they'll move from the state to the tribe. And then they bring in the the conduit for talks, and then that's how it happens a lot of places is where people come in from the outside and they bring in the expertise and they bring in the contacts and then they draft agreements. A lot of times starts with a mutual aid agreement and then it moves into cross deputizations.
Last word, Kit.
To what extent do you think that some of the fatalities could be prevented by just better access to EMS and transport to a trauma center? For example, I'm thinking about air medical transport and the financial incentives right now make helicopter companies set up outside of large cities because they need a certain volume to maintain the capital cost. But if there were incentives to maybe locate them in more rural areas or near tribal lands, would that improve the situation?
I'll answer some of that, and I'll let Lawrence answer too. I think it would have helped a lot. When I lived on Navajo, I've seen many crashes where if they had, within that golden hour, that person would have been saved. I've seen crashes where, or the police officers tell me too, they said that people were smashed into the crash vehicle, and if they just had that response time, they had, the person expired with less than an hour. So that I believe it will really make a big difference, if we had that golden hour. So.
Again, that's a really good idea, and I think that would help. But again, when you have a first responder, like, it takes 50 miles just to get there. And we do the best we can to train our officers. But it may come down to even helping to train the community members that are in those rural areas and providing them with the tools to be able to help, rather than, just giving them a training, but then you don't give them a med bag with the things that would help. But that is a good idea. If you did have a helicopter which is closer, and I remember when I was working on the ambulance years back, we were able to call in because our nearest air ambulance was in Fargo, and so when we identified on the ground the seriousness of the crash, we were able to call ahead and say, "Hey, we need the helicopter. This guy's this, and that," and then they would send either the air ambulance helicopter or the fixed wing, and that would reduce the amount of time that it took in the ER and getting them out to surgery quicker. But that's a really good idea.
Doug, you snuck in just in time.
Thank you. I'm very sorry to arrive late. My name's Doug Weeb. I'm with the University of Pennsylvania, and I'm in epidemiology, where we're all about counting up the nature and magnitude of the problem. Please forgive me. You may have talked about this already, but I'm just wondering, and I should know the answer. Crashes and fatalities and injuries that are occurring on reservation lands, do we know if they are being picked up in the national databases? Go ahead.
They are to a certain extent. I know there's big movement, at least from IHS side, to kind of get that all, to work on that. But yes, it's been a process. Especially they're picked up by trauma center. They take the trauma center and they're counted, but they have to crash on on the reservation, and they lose that golden hour and they expire. Then sometimes that fatality is not counted, or is not put into the system from the state side. So that's what my knowledge is.
Yeah, actually, she shared, I don't know if you saw it, Doug, she shared a book on the epidemiology of injuries. So, I mean, it's a different question as to whether you picked up nationally, but they have fairly extensive data.
Yeah, as far as traffic crash records go, we still have reservations that decline to share their information with the states. So the far as data analysts at the state level, they don't get that information. Our office right now has got a contract that's going to be going out for bids, where we're going to try and get a comprehensive look at every tribe that doesn't report, and then we're going to come up with a corrective action to try and get them to report. But I know, personally, just in my office, we've had fatal crashes that we would find out from the transportation division 2 weeks after the actual fatal happened on the reservation. So it still happens where the numbers are not there yet.
Thanks. Yeah, I was just trying to get a sense of to what extent, I mean, this is a small part of getting at the solution, but to what extent underreporting is hampering the ability to realize the magnitude of this problem in a nice, straightforward, objective way to draw attention to the problem. Thanks.
All right. Well, thank you very much for coming. Obviously, an important issue. So thanks for your time and your insights.